All right, meaner, hundreds of thousands will die. Really, folks, really? I raised this last week on Your World, my Fox News show, how out of control this hyperbole has gotten. And I mean out of control. Take a look. What's heartless is when the same Chuck Schumer says this Senate measure will send costs soaring while refusing to see those costs already are soaring. What is heartless is saying Republicans are actually killing people. They actually said that. When, in fact, what is really heartless is year after year of Obamacare lemmings lying to people, all the people, about deductibles now pricier than some premiums, and premiums pricier than most can afford. Now, if that is compassion, what counts for clueless? If that shows heart, how then to explain this present-day health care hell? That is what is heartless. That is over-the-top hypocrisy on the left. That is what is mean. So regardless of political viewpoint, when you're starting to reduce this to hundreds of thousands of people dying and you can't back that up or prove it or use anything approaching reliable numbers to vindicate what you're saying or to reveal what you're saying or just to remotely prove what you're saying, we're out of control here, folks. And all of this on a day we're supposed to get a technical sort of a clarification of the Republican plan in the Senate, the one that apparently is supposed to kill people. It's actually going to be sort of a precursor to the CBO, the Congressional Budget Office, scoring this thing, which I'm very glad I have my next guest to sort of clarify all of the above. The CBO acting director, the former acting director, Barry Anderson, who really gets to the heart of the matter by saying, look, none of these plans really address the underlying problem, which is the runaway cost involved in all of this. And Barry, very good to have you.
Good to talk to you again, Neil.
A lot of hyperbole, very little real cool, rational thinking behind all of this. But where's it going, you think?
Well, you know, I got to confess, when I look at the hyperbole that comes out of there, when I look at the bills, the first thing I think of is my grandchildren. What does the bill, what does it really mean towards my grandchildren? And when I looked at the Senate bill, again, I confess, the thing that really impressed me most was a reform of Medicaid. Medicaid is one of the big drivers of our unsustainable fiscal position long term. And finally, a bill is going to address some of that. And it can and should be addressed. So the hyperbole they're using about whatever, thousands of people dying and things like that, well, I try and look what's actually in the bill. And I really do think that taking a look at reforming Medicaid is long, long overdue, and that this bill can add to it. But as you said, Neil, I'm upset that it doesn't take a look at the real fundamental costs of health care. Of course, the Affordable Care Act didn't do that, nor did the House bill, nor did the Senate bill.
You know what I worry about, whether you are for Medicaid and for you can't be for the math that is increasingly not sustaining it. I mean, you know, something that used to, whose goal was to help 4 to 5% of the American population, and now we're up to 40% in some cases. That is simply not sustainable. So I'm wondering if the math on both sides is specious and we're going out of the frying pan into the fire, or what do you see happening?
Well, again, Washington needs a real kick in the butt in order to get things done. And this may be what they need in order to do the proper reforms of Medicaid. You know, there's an awful lot of Medicaid costs go to seniors. And people will say, but it's low-income seniors. But there are asset tests on whether you get Medicaid assistance as a senior. And the asset tests involve that you can keep a home greater than $500,000. Well, none of my kids own homes more than $500,000. Back when I was at the White House Office of Management and Budget, we used to have a little saying called reverse Robin Hood. That's where you take money from the poor and give them to the rich. Well, in this case, that may be it. I mean, if we're subsidizing Medicaid for seniors who have homes of $500,000 or more and taking it from people who have homes much less than that, isn't that sort of a reverse Robin Hood? I'm not trying to take a position on what should be done.
No, I understand.
I'm saying that reform needs to be done.
Well, that's the kind of thing that gets us to the point where we're going to have 100% of the population dependent on Medicaid, and that, barring like doubling and tripling of taxes, isn't doable, to your point, Barry. But thank you very, very much. Barry Anderson, the former CBO acting director. I didn't even realize the $500,000 house thing he was alluding to, but that's just part of the problem, isn't it?